Tonight, this free crash course is being brought to you by LW Pharmacy School, and I am your host. I will definitely be with you as you ride this journey. This is October free PTCB crash course. If you have not subscribed to the channel, if you haven't followed us on Facebook, please make sure you do that at LW Pharmacy School. We are there pretty much every day, dropping new tidbits and new tips to help you to succeed on your board exam. Okay, so some of you may have known or may not know that Pharmacy Technician Day is this October 2020, right, which is next week, and we are celebrating Pharmacy Technician Day by offering you all 20% off. So right now, all of our courses that are for pharmacy technician are completely 20% off. You will want to take advantage of that particular tip or this sale as soon as you possibly can, because we don't know how long this will be here. We are celebrating Pharmacy Technician Day, and I think it's really cool that we are in a career or an industry where we're celebrated. So many people, I know friends who are CNAs and medical assistants and things like that, and they don't have a day that they're celebrated. So I think it's really cool and neat that we are celebrated inside of, or as a pharmacy technician inside the industry. Our 15-week online pharmacy technician course is open for registration right now. The next class will start November 2nd. So if you are interested in learning more about that, you can definitely register at lwpschool.com. Our 4-week online refresher course is also 20% off. That is a really great course for individuals who are studying to pass the board exam and may already have experience. We definitely have it broken down, and we have an agenda as to what you should be studying every day to keep you on track. So if that's something that you are considering, I would definitely encourage you to do that with us, because we are number one right now in regards to the way that our students pass. We are so excited for just the great pass rate that we have. And so if you are interested in gaining your certification and getting this done before the holidays, because y'all know once Christmas and Thanksgiving come, it is just going to be moving. Life just begins to move a lot quicker. So if you want to do that right before the holidays, you can. This is a great way to get some extra cash in your pockets. Let's jump into it. Okay, drug classification. I did want to give some information about drugs because I keep getting this question over and over and over. And a lot of times I feel like, even to, when I was putting this content together, I was like, oh my God, I feel like we're talking about the same thing, which is good because repetition is what's going to help you to remember, so that way you can pass this board exam, which is why we have over 85% pass rate, because our students are learning repetition over and over. Drug classification, the easiest way to remember your drugs, and I cannot say this enough, is prefix, infix, and suffix. Come on. If you can remember prefix, infix, and suffix, then you can pass this board exam and you can ace when it comes to these top 200 drugs. I want you to know that it's more important for you to remember the prefix, infix, and suffix than it is for you to be trying to study word for word, okay? We're going to go into what prefix, infix, and suffix looks like inside of an actual drug name, okay? But generic medications are non-proprietary names. Brand names is proprietary names, so on and so forth. I think you all are more than capable of reading that slide. Therapeutic agents for the nervous system. So anxiety, okay? Anxiety is a condition that affects the nervous system. Okay, I think that anxiety is at its all-time high right now, not just because of COVID-19, but because of all of the access we have to computers and to social media, and just every way that we as humans can be judged and it be on display. I think that that has definitely increased the anxiety for so many Americans and so many people just all around the world. For the most part, the STEM word for anxiety medication is AZPAM, or AZOLAM. Okay. I am going to highlight the drugs that are very common, the ones that you're going to see on your board exam. How do I know that you're going to see them on your board exam? Is because I work with students every day who've taken the board exam, and I've been able to talk to them, and they're like, hey, this is what I saw, this is what I did, this is what I learned, this is what I, was able to demonstrate on my exam. Parkinson's disease, those drugs typically end in DOPA. If you look in the middle, that is a actual drug bottle with two drugs on there that is used to treat Parkinson's disease. And this is kind of going to be that combination drug, okay? And then depression, sertraline, which is also Zoloft, right? Sertraline and tryptamine, they almost sound alike. Like they ended at LINE, towards the very end. One of the things that one of my students came up with, amitriptyline, which is that last suffix, she came up with something and she said, am I tripping? And the name of the drug is amitriptyline. And so if you've been studying that drug and if you've seen it, then you know what I'm talking about. And she said something to the effect of, am I tripping? And so every time she saw amitriptyline, she knew that it was used for depression. You just have to come up with ways that make it fun so you can learn and so you can grow and so you can maintain and pass this board exam. Therapeutic agents for the gastrointestinal system. By the way, if you have not liked, subscribed, and followed this channel, please make sure that you do that as soon as possible. Do that now so you can get notifications as to when I post new videos. I am going to be doing a lot more posting than I have been. COVID-19 is basically wrapping up in my mind, even though I know it's still in the country, but we are starting to see more sense of normalcy. So you'll be seeing me a lot more than you had been here lately. So make sure you ring that bell as well. Therapeutic agents for gastrointestinal system. Histamine 2 antagonist, which is tidine, and then prazole, like omeprazole, Zantac. The brand name is Zantac. The generic name is ranitidine. It's like RANDITIDENE, which is that first suffix. That is going to be used to treat gastrointestinal. So you're talking heartburn, you're talking acid reflux, that sort of thing, which is really common, now because so many people are, and I think it's what they're putting in the food and so on and so forth. So you'll see those a lot. Both of these drugs are over the counter. I do know that Zantac did have a little bit of a recall. And so it may not be out right now, in Walgreens, but definitely Prilosec, omeprazole is there. You'll see those side effects of these drugs. Now, I want you to know that I just didn't put the side effects of these two drugs. I put the side effects down of gastrointestinal system drugs, period. Yes, period. I did that because I want you to know that most drugs have pretty much the same side effects and they have a lot of things in common. And so I put headache, nausea, and diarrhea. Now, did they have some other side effects that are not common? Yes, they did. But why try to remember the hard side effects instead of remembering the ones you already know? You already know what a headache is. You already know what nausea is. You already know what diarrhea is. It's easy to remember something that you're already familiar with. You can thank me later, because that right there will take you to the bank and cash the check, okay? Do what you're good at. Do what you know. Go with what you're already familiar with. Stop wrecking your brain trying to learn new things that, are there, but you have familiar things that are there and you're constantly picking the new things because you're like, well, I don't want to make it too easy for myself and I want to make sure that I'm, studying the way that they want me to study. No, you study the way that your brain can retain the information. You study the way that you can soak in the information so you can demonstrate it on the exam. That's what it's about. It is about passing this whole board exam. I keep telling people, look, let me tell you something. The same pass score that you get, whether it's a 1400 or 15 something, it's going to work the same way that the next person get who might have made a 1580 or whatever the highest score is that you can make on this exam. Okay, I believe it's like a 1600. You just need to pass this board exam and give it your all to get that passing score. Therapeutic agents for the renal system. So we're talking diuretics, thiazide diuretics, loop diuretics. I saw this question not too long ago on like a practice exam. Thiazide diuretics have the word thiazide at the end. Hydrochlorothiazide. Loop diuretics like furosemide, Lasix. It is used to get the acids or to reduce the fluid on the body, right? It does have an interaction with diabetes, lithium, and certain blood pressure medications, which is funny because this is something that sometimes the doctors will use in conjunction with the blood pressure. They may give them some type of fluid pill because we know that if they are retaining fluid on the body, then it's possible that their pressure will be high because they are retaining that actual fluid on their body. And so when the fluid is there, it does increase that blood pressure. And so you may see this, that it is done in conjunction with that. You may see it a combination, drug, that type of thing. But definitely thiazide diuretics and loop diuretics are used as a water pill to reduce the fluid off the body. Diabetic supplies. I wanted to jump in here a little bit and talk about how to answer questions on the exam. How to answer questions on the exam. Diabetic supplies. How long can a cartridge of insulin be stored at room temperature before it must be discarded? So here are some key words here. It says how long, so that means that we're looking for the answering to be in, a length. So we're looking at either time, days, or month, but the answer choices tell us that we're looking for days. So we know that our answer should end in days. It says insulin be stored at a room temperature. So what is room temperature? You need to think about that. That's something you need to know, and that's something you need to remember, the room temperatures. If you are studying and you are not remembering room temperatures, then you are definitely setting yourself up for, not to be as successful as you could be. If you are struggling with remembering room temperatures, definitely give us a call, or, better yet, register for the course, because this is something that you can definitely learn. You can email us at info@lwpschools.com, and we will talk about room temperatures and exactly what room temperatures you need to know in order to pass that board exam. It says must be discarded. One thing I'll tell you is that in that PTCB blueprint, it does talk about diabetes supplies. So that's another thing you want to be familiar with. I am referring to my book right now that I have in front of me. Y'all know this is my favorite book because it tells me it shares with me the actual items and topics that we should be studying in order to pass this actual board exam. And diabetic supplies is definitely on here, okay? And so let's see. This is a Levothyroxine, and that says Flex Touch, but that's not, the same. It's just a picture. Room temperature Levothyroxine must be stored for 42 days. 42 days. That's after you have opened it, okay? 42 days. Another thing that you want to make sure that when you are learning about the diabetes supplies, you want to make sure that you pay attention to room temperature, which is the storage time, and how long the medicine, the life, or the life span of the medication, because that is something that you will see on your board exam. You also want to make sure you understand the strength of the insulins too. What strength does it come in? What's the unit? And so some people struggle a little bit, and I know for a fact that that type of question is on your exam. Seizure treatment. A patient is diagnosed as experiencing partial seizures. Which medication is an appropriate treatment? Seizure. We just talked about seizure being, we just talked about the nervous system. And so when you think about the nervous system, you want to start thinking about, okay, I got Proton on here, I got citalopram, I got gabapentin, and I have trazodone. Okay, what can help me with the whole nervous system? In this particular instance, knowing that the brand name for gabapentin is Neurontin would have saved you, because Neurontin stems from nervous, right? Or neurons, right? And so when you have Neurontin as the brand and gabapentin is a generic, this is one of the instances where knowing that brand would have helped you. I will say, and I've said this before and I will repeat it again, I believe prefixes, infixes, and suffixes is sufficient enough in order to pass the board exam, and to kind of, you know, make sure that you can demonstrate competency. But this was one where gabapentin, the brand Neurontin, would have helped you. Now, if you're in the pharmacy, or, you know, if you maybe are working around medications, then you would know that gabapentin is one of that's a very common drug. Citalopram is very common. Trazodone is too. These are very common drugs. And so knowing that brand name there was good, but trying to remember brand names for all 200 drugs is impossible. Pharmacist instructions. Which terms on a prescription is the instructions to the pharmacist? And it is the subscription. Think about the word subscription. Sub, the root word, or not the root word, the prefix of prefix of subscription is sub. The prefix of subscription is sub. Sub means under, right? So on the prescription, typically the directions are always written under the patient's name, under the medication's name, right? And that particular information is what the pharmacist reads. Really, we read it and we translate it into the computer and do the data entry and all of that. You know, they're saying that it's going to the pharmacist, but a lot of times we read it first because the pharmacist gets it on the other end. But what I want you to focus on here is the fact that they are actually saying subscription, and sub is under. And so since sub is under, the directions are going to be under the actual name. Didn't I tell you was going to pass? I told you. I said, what you need to do and what I want you to start doing for yourself is to believe in yourself, friend. You don't have to worry about trying to be, you know, the best there is who's ever studied pharmacy. That's not your job. Your job is to pass. Everything that you have learned in your previous experience, whether that was a cashier at a grocery store, whether that might have been an assistant for some type of corporation, that could have been a teacher, you could have been anything, you could have been a bartender, a waitress, a waiter, it doesn't matter. It has all worked for you up until this point. Now all you need to do is take the baton and cross over the finish line and get that certification. And I'm here to help you with that. I told you, you're not going to be alone when it comes to passing this board exam, okay? So don't worry about that. Beyond use date. Now, I like to talk about the beyond use date, and I like to give the analogy of cooking. Okay, so go with me, just go with me, don't go any further. So let's say you go to the grocery store, you get some chicken or some shrimp or some salmon or whatever it is you want, right? And you get it, and it says that the expiration date or sell by date, because that's what they put on the package, they say sell it by such and such. The sell by date is October 31st. So here it is, you buy it today. Today is, you know, October 12th. You buy it today, October 31st, sell by date, you're good. They say sell by or use by October 31st. Please store in the freezer, right? So you can preserve it. So you put it in the freezer, whatever. You get home and you bought it today and you cook it tomorrow. You cook it, you make some chicken casserole. And so stay with me, don't go nowhere. I'm painting this picture for you, okay? And so you make the chicken casserole, everybody eat, but you have some left over. You make it on October 13th, right? Will that casserole be good until October 31st? Remember, you made it October 13th. You had some left over. Will that casserole be good until October 31st? No, it will not. So now at this point, the actual expiration date that they gave us of October 31st is null and void because I cooked this on October 13th. So now I need to give it a beyond use date left for my leftovers. I'm going to give my leftovers a beyond use date. Did not tell you everything I'm trying to tell you. I said you already knew this. You thought I was playing. So cooked it October 13th. It's probably going to be good for, I'm real, like for me, I don't do a lot of leftovers. I get a little nervous about certain leftovers, especially seafood. I'm like, I'm not going back to that the next day. So October 13th, we're going to say, I'm going to say 3 days, and I'm going to be gracious because I'm talking to y'all, but if it was in my house, I would really be like, okay, 2 and it's over. And so anywho, we're going to give it a beyond use date of October 16th. That is the difference between an expiration date and a beyond use date. An expiration date is given by the manufacturer. The beyond use date is given by the compounder, where you became the compounder of that chicken casserole when you cooked it. Look, see, y'all, I told you. So now the question says, which is the maximum beyond use date that may be assigned to a water-containing oral formulation of a non-sterile compound at a controlled cold temperature? Basically, a controlled cold temperature is the refrigerator. Come on now, don't get all worried and crazy on me. Controlled cold temperature, they say in the refrigerator, okay? So you could change this question around and say, how long will these leftovers last and in the refrigerator? Okay. Now, I want you to know that when I think about this type of question, I always think about amoxicillin, that pink drug. And I think I've said this before and I'll say it again, because that pink drug is something that, you know, is pretty common. It's prescribed for ear infections, this, that, and the third. And so they put that inside of you know, the bottle, and they shake it up with water. They're reconstituting it. Anytime you add liquid to a powder, you are reconstituting. I'm dropping all kind of hints tonight. I'm giving all kind of game away. I hope you're paying attention and writing this down, because some of what I'm telling you, you're not going to find in this book. Come on, don't play. Y'all already know we're going to keep it 100 all the way real, okay? So with that being said, when we are talking about reconstituted drugs, they have a lifespan of 10 to 14 days. 10 to 14 days, okay? This says 14 days because that's going to be the answer here. 10 days is also a good answer. And the reason why I say 10 days is a great answer, because a lot of times when parents pick up medications, and let's say the child has a sibling. Let's say this child had chickenpox. I'm just going to throw that out there because it's contagious. Child gets chickenpox, they have a sibling. So the parent, being a parent, I'm a parent, will think, okay, Rebecca had chickenpox and I use this medicine for her. So I'll just keep this medicine just in case Alice get the chickenpox, and we'll just use the same medicine for Alice. And parents will do that thinking that they're saving money and that they're, you know, saving time. In actuality, if you give it at 10 days, then they still have 4 days to actually use it without it being harmful to the body. 14 days is the actual maximum cutoff. That's 2 weeks. 14 days is 2 weeks, and that is the cutoff for beyond use date of a water-containing oral formulation. That's what you need to remember. Water-containing oral formulation, and basically all that means is that is the cutoff for any medication that was reconstituted with water. What did I say reconstitution was? Powder mixed with a liquid. You are listening. Thank you. That makes me so happy when y'all are listening and actually responding. It makes me so happy. Okay. Happy Pharmacy Technician Day to you anyway. I know that it is not until October 20th, but I still want you to start celebrating. Put that smile on your face because you are beautiful and you are worthy to be celebrated. Pat yourself on the back, hug yourself, and smile because life is too short to do it any other way. I did want to share with you, before we continue, how to study and pass the board exam. So many of my friends have called me and emailed me and said, how do I study? How do I do this? I am confused. I am lost. I am worried. I am scared. And my job is on the line. You know what? I get so many calls from people who are working inside the hospital or working inside the pharmacy, and their job is on the line if they don't get that certification. I'm like, oh my God, that is stressful. That is something that will definitely just like have your nerves bad. So anyway, if you are in that situation and you are trying to pass this board exam so you can keep your job, the first thing you need to do is register at LW Pharmacy School. You can go to www.lwpschool.com, click register, and you can register for that 4-week course, okay? If you have any issues with that, email us, info@lwpschool.com. The second thing you need to do is order this book. You need to order this book because if you are still like, one of the things that y'all do, and I know we cool, so I know I can say this to you without you getting frustrated or offended. But one of the things that y'all do is y'all will study from this book, study from that book, use this app, use these online practice questions, use this, talk to a friend that took it 5 times, talk to another friend that actually passed it but don't have a job in pharmacy, go and talk to this person, and then come back and try to pass that test. How you gonna pass the test? You don't got information from 15 different sources. Who Lord, that wears me down just thinking about it. You just need one book. You don't need 15 different sources to pass this board exam. Y'all have given it way too much power. I mean, people are not sleeping. People are just, stressed out. It is really, look, it's just a test. All you need is one book and an expert like me so you can pass this board exam and move on with your life. I get people who say, I done took this test 3 times. I'm like, oh my God, you just not calling us? And then they pass it right away and they're like, I don't know why I was making it so hard. Look, child, I don't know why you was making it so hard either. www.lwpschool.com, and we got you. Day supply. I think that this is the easiest math problem to do, in my opinion. If you do not have your calculator, get your calculator out or your phone, calculator or phone, and let's go ahead and look at how to solve this, okay? Now, a patient receives the following script. How many days? So it says days. That means that our answer is going to be in days. I want to look at my answer choices to make sure that my answer choices match up with what they're asking for in the question. Because sometimes they ask for stuff in the question, but the answer choices don't always match it, which is the key inclination that certain answer choices can't even be the answer because it doesn't even match up to what the author asked in the question. Knowledge is power, okay? How many days will the prescription last? Albuterol HFA 200 inhalations, 1 canister, 2 puff inhaled every 6 hours. Okay, so let's break this down a little bit. We got a patient who is going to receive this. The question wants to know how many days will the script last? Okay, so this is what the patient is doing. They are taking 2 puffs every 6 hours. So if they're taking 2 puffs every 6 hours, how many puffs a day are they taking? Can you drop the answer in the chat? If they are taking 2 puffs every 6 hours, how many puffs a day are they taking? If you don't have access to the chat, I hope that you're working this out while I am talking you through it. They are taking 8 puffs. Very good. And it says that the inhalation contains 200 puffs, or the canister, not the inhalation. I don't know why I said that. It says that one canister contains 200 inhalations. So if they're taking 8 puffs a day, and we got 200 puffs in the canister, how long will this canister last them? 25 days. Very good. Was that hard? No, because you're smart. I told you, friend. Concentration and dilution. Concentration and dilution. So let's talk about this for a little bit. The formula is initial volume times initial strength equals final volume times final strength. Here it says if 120 milliliters of the 2% weight over volume, what is weight over volume? Is this Ben & Jerry's pint of ice cream measured in volume or weight? Figure this out where you are. Is the Ben & Jerry ice cream measured in volume or weight? Somebody Googling right now trying to figure it out. Look, what I tell you, look, let me say this. Use your resources. Use what is right there in front of you to help you. If that's what you feel like you need to do, friend, to succeed, that's your business. Do it. While you're trying to figure that out, let's think about something that's easier. Is the drink that is being poured into this wine glass, is it measured in weight or volume? Weight is a solid. It's what solid items are measured by weight. Solid. Me. I'm solid and I measure by weight. Liquids are measured in volume. 500 milliliters. Your drink, 500 milliliters. Volume. Your milk, volume. Tea, volume. Liquids, volume. Weight, solids. People, weight. Books, weight. Solids are measured in weight. Now that we're clear on that part, let's keep it pushing. Now it says if 120 milliliters of the 2% is diluted, what does diluted mean? Diluted means that you took something that was strong and you added more water to it, and now it becomes watered down. So let's say that you had a Coke that you got from the store and you add ice to the Coke, okay? But before you add the ice to the Coke, you drank it, it burned your throat. You said, ooh, this Coke is strong. It had you burping and everything. Then you add ice to the Coke. You go outside, walk your dog, or walk to the mailbox. You get on the computer to look at Facebook and Instagram when you should have been studying. Now this ice done melted in that Coke. You come back, you thought you was gonna drink that Coke with your food, but the ice done melted in the Coke. Now the Coke has been diluted. So you started out with a Coke that was 2%, but when you added the ice to it, it diluted the Coke from 2% to like 0.5%. I'm not gonna say that's the answer, I'm just saying. I want you to think about dilution, okay? Just wanna make sure that we can keep it pushing. They diluted it with water to 1 pint. So we started with 120 milliliters, okay? Which is the size of this wine glass. And then we diluted it with water to 1 pint, which is this size of the ice cream. This 1 pint is a lot bigger than this actual cup of 120 milliliters. So whenever you dilute something, you are adding to it. I know for a lot of people, diluting, when you read it in a question, it looks totally different than it does in your everyday life. I know it. That's why I'm here to help you. And so when you dilute it, you're actually adding more. Yeah. You add more when you dilute it. It says, what will be the strength of the dilution? So we know we started out with 2%. And now we are going to find out what is the final strength of the drug. So here we are. We started off with initial volume times initial strength. Initial volume would have been 120. Initial strength would be 2%, right? I don't have my computer pen with me tonight, so I'm using my mouse. Don't judge, okay? And then it says it's diluted to 1 pint. So that means that is the final volume. That's the final outcome, is 1 pint. And then it says what will be the strength. So now we know we're solving for FS, which is easy to do. Now, another thing I want to show you is in your problem, 120 and 2% came together. So we're going to keep them together. Okay, so now we know 120 goes underneath IV, which is initial volume. This is where you need your calculator. So you have 120, and now on the side of that is 2%. So my formula tells me to do initial volume times initial strength. So I'm going to do that. I'm going to do 120 times 2%. That is going to give me 240. It's going to give me 240, okay? Now I have to work with this 1 pint, which is my final volume. How much is 1 pint in milliliters? How much is 1 pint in milliliters? Even though I know we're dealing with weight over volume, you still have to turn this 1 pint into a number that you can work with. You cannot work with the number 1, because if you do 120 times 2 divided by 1, you're going to get the same thing. So what is the conversion for 1 pint? Come on, we having thought-provoking conversations tonight. Yes, honey. 480, yes, ma'am. Okay, so we're going to do 120 times 2 divided by 480. I got too excited. I mean, my friend knew the answer. I was like, hey, friend. 120 times 2 divided by 480. And what is our answer? 0.5. Yes, it is. Yes, yes. That is concentration and dilution. And yes, you need to remember that formula. You definitely need to remember that formula. Auxiliary labels. Auxiliary label. Which auxiliary label should be affixed to a prescription of naproxen? Take with food. You need to take this prescription or particular medication with food. Naproxen, it is a pain reliever. It is not a narcotic, it is a pain reliever, okay? This should be taken with food. You want to be familiar with your auxiliary labels because you want to make sure that things are being affixed to the actual prescription the way that it should. So many of you all have said, I need your help to pass, Lindsay. Can you help me? What can I do in order to pass this board exam? And I want you to know that you can get my help by registering for our online courses. Now, our pharmacy technician program and refresher course is actually in a place right now where it is 20% off. 20% off all pharmacy technician services. And you can take advantage of that now. Pharmacy Technician Day is October 20th, 2020. We're also planning to do something very special outside of this to celebrate that day on the day of. So make sure you stay tuned. If you are not subscribed and have not liked this channel, please make sure you do so now. Ring that bell for notifications so you can stay alert and get those different notifications when I post. Like I mentioned, I will be posting a lot more. But in the meantime, I want you to believe in yourself. I want you to trust yourself. I don't want you to doubt yourself. Don't give in, don't give up, don't give out. It isn't over. It's not over. It doesn't matter what anyone has to say. It doesn't matter who have doubted you in the past because you have proven them wrong. The fact that you are on this race, like on this journey, in this race, shows that you have more courage and bravery than you had a year ago, 2 years ago, even 2 days ago. I mean, I know I feel like a much better person today than I did, last week. And it's because of the constant work that we put in every day, in the way that we are determined to win and to make something of ourselves. You want to look back at this and be able to show your kids, or maybe be able to show your parents, maybe be able to show a loved one. This is what I've been working on, and this is what I've done, and this is why I didn't go out to every party with you. Or this is why I have been, a little distance, is because I've been working on my career. And so I want to let you know that I am here to support you. There is nothing in this world that can keep us apart and keep us away from being great and being who we were supposed to be, and just walking in the order that God has created us. Please continue to take care of yourself. Make sure you stay safe. Make sure you stay well. And most of all, make sure that you show yourself some love. Every day is to be better than the day before. I'm not in competition with anyone, or even myself that's 10 years from now. I am trying to be better than I was yesterday. So if I didn't study at all yesterday, but I only studied 5 minutes today, I did better today than I did yesterday. And then if tomorrow I study 15 minutes more than I studied today, then I did better that day than I did the day before. That's all this is about, is doing something different and making a cognizant decision to say, I'm going to be better today than I was yesterday. Continue to trust in yourself, continue to believe in yourself, continue to just put your best foot forward, and you will see how everything that you have put in will work out for you. Thank you so much for taking the time to be here with me. Thank you so much for watching this, and I hope to see you again. Have a good one. Bye.